As usual, start with washing the hands and introducing yourself to the patient. Briefly explain what the examination will involve and gain consent to proceed with the examination.
Good morning. My name is Eugenius. I'm one of the medical students. Today I would like to examine your knee sensitivity. Okay.
Ensure adequate exposure. Ideally, one joint above and below should be exposed. Begin with a brief general inspection of the patient to assess the patient's well-being. Thoroughly examine the front, side, and the back of the joint. The skin, tissue, and the bones should all be taken into consideration. On anterior inspection, within the skin, you may detect scars, erythema, or laceration. For soft tissue, look for any effusion which can be detected by looking at the dimple on the medial side of the patella. Muscle wasting of the quadriceps may also be present. Note also the alignment of the leg for any varus or valgus deformity. On lateral inspection, check for hyperextension, fixed flexion, foot arc, and toe deformities. Posteriorly, check again for any scars, skin changes, muscle wasting at the calf at gastrocnemius, popliteal swelling, as well as the Achilles tendon. Next, ask the patient to walk to assess the gait for any abnormal gait, such as antalgic, lateral thrusting, high stepping, or Trendelenburg. Ask the patient to squat down, which indicates an intact hip, knee, and ankle joint. Ask patient to sit and to point out site of maximum tenderness. Proceed to assess the temperature of the limbs. A comparatively warm joint may indicate inflammation, while a cold one may point towards nerve or vascular damage. In supine position, proceed to check for any fluid effusion by doing two tests, which are fluid shift and patella tap. For fluid shift, massage from anteromedial side of the knee up to suprapatellar pouch, and stroke lateral side and look for bulging at the anteromedial compartment of the knee. Next, check for patella tap. It is positive in cases of large effusion. Rest one hand on the lower part of the quadricep muscle and compress the suprapatellar extension of the joint space. With the other hand, push the patella downwards. Next, flex the patient's knee to 90 degrees and palpate for bony prominences as shown in the video here.
Tibial tuberosity, patella tendon, medial tibial plateau, medial joint line, suprapatellar pouch, medial femoral condyle, quadriceps tendon, lateral femoral condyle, lateral joint line, lateral tibial plateau, head of fibula.
Now, watch as the patient flexes and straightens each knee. Observe the patella tracking. As the patient extends, the patella glides upwards and remains centered over the femoral condyle. For movement, assess the range of motion by placing one hand on the kneecap while the other moves the legs up and down. Normal flexion of the knee is 0 to 135 degrees, while normal extension is 0 to 5 degrees.
Alright, so next is for special tests. We have 4 special tests, which is anterior drawer test, posterior drawer test, valgus varus test, and McMurray test. For anterior drawer test, patient's legs position must in knee flexion and then sit on patient's feet. Use both hands and put 4 fingers behind the knee and thumb on the joint line and pull with force towards you. Positive anterior drawer test mean ACL injury, which is anterior cruciate ligament injury. For posterior drawer test, stabilize the knee in the same position of your body, patient's knee and your hand. Just push the knee with force. Positive means posterior cruciate ligament injury. Then compare both knees. For valgus varus test, with right hand on the patient's feet and left hand on patient's knee. With left hand, gently push the knee away from you. At the same time, right hand pull the feet towards you. Same to check for various tests. Left hand gently pull towards you. At the same time, right hand push away from you. Next is McMurray test. Flex the hip and knee flexion. Right hand on the patient's feet with left hand support the knee. To test medial meniscus, using right hand, externally rotate the tibia at the ankle and apply valgus force at the knee with your left hand, then extend the knee. For lateral meniscus, internally rotate the tibia and apply varus force at the knee, then extend. Repeat the test looking for palpable or audible click in the knee during extension or bend.
Finally, palpate the pulses at dorsalis pedis artery and posterior tibial artery.